shifted. I mean, there's literally, when you look into people, there's 200 different types of headaches, and there's no reason why a horse shouldn't have it, given it has a head. I have actually written an article about it. You can find on Google. You can Google. And
we should send that out to the group.
so it's kind of difficult to diagnose it in a way, because the only diagnosis we have in people is that a person says, I have headaches. When I started for the first time thinking about this, I was like, well, what are they doing with babies that have headaches, or with, children that cannot speak yet? Well, there was at that time nothing written about it. Now people start, because they know that with certain severe disease process there is always headaches involved, but you can have headaches on any level. So the diagnosis is basically only confirmed once you're able to treat it successfully, because the symptoms are nothing totally specific for just headaches. But when I was observing him now the whole time, there's a bit of a pained expression in his eye to me.
Yeah.
And even when he relaxes, it's only disappearing for like a fraction of a second, and then it's right back. The reactivity is very typical, of not being able to be touched in the face and have that be a comfortable thing. It is also can lead to that they really don't want to be touched anywhere else, because they're so occupied already. They're spending their energy on this. And it can also affect their presentation in the gaits, because the hitting of the hoofs on the ground can make it worse. So, he has a little bit of discharge. I don't know if that's typical for him or not. It could be a sinus headache, So the ways I have been addressing it is I usually, because it's the easiest thing to do, and if that's the cause, it's the fastest to address, is I evaluate them chiropractically and see if the atlas is involved, the first neck vertebra, because that by itself can cause headaches. If it is not, I usually check them craniosacrally too, which means that I'm making contact to his skull bones. And horses that have jammed up skull bones, they respond exactly how you just saw it. You do the lightest touch, and they just thrash their head around. And they basically have to go through that while you're holding the craniosacral contact to be able to release, and that can actually take some time. T-touch is possibly a method to release headaches. It depends on, again, the source, the severity, and so forth. And you can also use acupuncture and herbs. So what is needed is not possible to tell without going through it, but the fact that he has discharge would make me,
He's had that as long as I've had it.
yes, and it's not normal, right?
Yeah. Well,
So that would fit together, that he has had it for as long as you've known him, and for as long as you've known him, he has exhibited this behavior.
Interesting. He does have regular chiropractic.
Mm-hmm. So yeah, I'm actually suspecting that it's something related to the discharge.
sinuses,
Yeah.
And that's the feeling I had yesterday, by the look on his face, that he really loves you, he really does the best he can, but something is going on, and that's why I wanted to, can we just put your hands quietly on your face? Sorry, for those of you who don't know Ella, Dr. Ella Bittel, who's a holistic veterinarian, used to be from this area, and now gifted us back here for a few weeks, but she lives in Costa Rica, which is hard for us. Okay, so